and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to talk about some services that are provided to the homeless to help them become more stable and move toward a better situation for health care, for jobs, and for hopefully a permanent living situation. My guest is Matthew Stearn of the organization HELP. Welcome, Matthew.
Thank you so much for having me.
I think, people think of the homeless sometimes when it gets cold or when they pass people on the street who are asking for donations, but there's a year-round population, probably constantly changing, but of folks who are in a bad situation and need assistance. What do you all provide? What are ways of getting folks who are in this bad situation out of that?
So there's a wide range of need that we try to take care of here in the City of Hampton. So it's not just folks who are homeless. That's one particular section of people that we try and help out as best we can. The other section is folks who are both low income and uninsured. So many of which are not homeless, who are housed. So our focus goes, we try and help those who are homeless, so homeless services, medical and dental care for the low-income uninsured, and support services for whoever needs them.
So you've really branched out as an organization because I think people's need doesn't stop once they get housing. Right. Or people might be so on the edge that they could fall, they could lose that housing if X, Y, or Z didn't happen, if Absolutely. They didn't have some of these other supports. So let's talk about that. What can make a person become homeless? How do people end up in that circumstances? Because I think sometimes people like to go, well, that could never happen to me.
True.
But it could.
Absolutely it could. So one of the really easy ways to look at that is through our medical and dental services. Our medical and dental clinic is at the Social Services Building. It's the Dr. Richard F. Clark HELP Clinics. So we offer primary medical care services and dental care services for those who are low income and uninsured. And we defined, and just recently redefined, low income as anyone who makes 300% of the federal poverty level or below. So an easy marker for that is a family of four. So say mom, dad, 2 kids, even a mom, 3 kids, dad, 3 kids, that if that household makes less than about $75,000 a year, they're eligible to come receive subsidized care at our clinic. Now, as we think about the rising cost of health care, always, even with Medicaid expansion, taking care of those who are at 138% of the federal poverty level and below, it still leaves around 6,000 individuals in the City of Hampton who fall within that low-income uninsured bracket, where the cost of copays, where the cost of insurance premiums, where the cost of dental insurance can build up. And if we can remove some of that burden from an extra bill, we can allow that family to spend that money on rent or on utility bills, or say save a couple dollars for a rainy day fund to make sure that they don't end up needing our other services.
Well, and there are so many needs, and sometimes some of these policies are super high deductibles, so that people, even if they can afford the insurance, they can't afford the deductibles, right. Especially if they end up needing something very expensive. Or the medication. A lot of times people are on plans that don't cover medication. That can be very, very pricey. So if you can cover the service, maybe they can afford the medication that they need. And if people can't stay on medication for a chronic illness, they can end up in a much more expensive and much more critical healthcare situation.
Absolutely. The most expensive care that anyone can receive is in an emergency department or emergency room. So if we can take those folks in and offer them primary care to help with chronic conditions, to help manage, say, blood pressure, help manage blood sugar and A1C, then we can reduce the cost on all of us. All of our costs will go down, because if we're reducing the cost on hospitals and the healthcare systems, then that helps us all reduce the cost of healthcare.
Well, and honestly, I think that's an important thing to state, because I think everybody out of the goodness of their heart would like to help people. But there's also a little bit of self-interest here too, because if people's only recourse is the most expensive one available, because nonprofit hospitals, have to treat people once they get to the emergency room, someone pays for that.
Absolutely.
And that is all the other users of that hospital or that health service. And so it does cost all of us in the long run.
It does.
And so figuring out how to keep people healthy is good for those individuals and good for community, but also good for all of our bottom line.
Absolutely. And if you don't have dental insurance, I mean, and you
That's
have
a
a tooth that needs to
huge
come out, you're talking, $250 in some cases per tooth. I mean, that can get really expensive really quickly. And many times that comes into a kind of an emergency situation where if you're in pain, that's some of the worst pain that you can experience is oral pain. So if we can help people get those acute conditions taken care of quickly, but can also get them on a regular regimen of getting their cleanings when they should for a low cost and not having to also deal with the burden of whatever their dental insurance may cost.
Right.
Then we can save them money and save them
Because cleanings
pain.
are cheaper than fillings, which are
They
cheaper
are.
than root canals, which are
They
than
are.
extractions. I mean, those infections can spread. It can become a very, very serious health issue
Even
in other
life-threatening.
places. Yeah.
There are over 100 different conditions that can be discovered simply by looking at your oral health.
Wow.
Yes. It's incredible to think.
So you guys have this clinic, which is really because of the expanded Medicaid and people being covered under that program, you're able to fill more of a gap for working folks who still can't pay for all of their needs.
Yes. So the range really for folks who are uninsured and can come to our clinic is anybody who's working full time and makes $8.25 an hour. You probably don't qualify for Medicaid because you make too much. But if your household is making, say, $35 an hour between the two of you, you may be able to qualify for care at our clinic just because you may reach the upper limits of where we're at.
And it really extends the different sorts of healthcare options so that fewer people are going to be left out.
Absolutely. Absolutely.
And that's important. What else I'm so excited about this healthcare thing, but what else do you offer? Because there's a lot of programs that you have to try to get people into more permanent sheltering situations, to try to get people into jobs, longer term programs that can help them.
Absolutely. So our mission at HELP involves serving the most vulnerable people in our community. So whoever those people are, and of course we've talked about the medically vulnerable, the dentally vulnerable, and we could talk about those who are vulnerable when it comes to housing. So a lot of our services focus on the homeless and those who are potentially going to be homeless. Of course, we have the Nice Welcome Winter Shelter Program, which is a 21-week program, which will offer probably around 7,000 bed nights of shelter this year. Our churches will take care of around 15,000 meals for folks who are literally street homeless.
That's huge. And that helps almost half of the year.
Yes, absolutely.
Counting up weeks here.
About that. But we also have emergency housing and kind of bridge housing, transitional housing programs that help people get back up on their feet for 3 to 6 months. We want to make sure that they have a chance to become fully functioning members of society again, to maintain their own apartments, to maintain their own jobs, and to be successful on their own.
Are there different programs if it's a single person versus if it's a family that's homeless?
Absolutely. So all of our services when it comes to housing involve case management. We have a full-time case manager who works with individuals to try and make sure that they have the next steps covered, whether it's needing better employment, needing employment in general, finding benefits for which they may be eligible, applying for Social Security possibly even, to help direct them in whatever ways will stabilize their household.
One of the things I was also going to say, when you get them into a situation where they have medical coverage, Medicaid now, or any of those other services will also treat chemical dependency, substance abuse. They can get that sort of long-term things that they need, which a lot of times people have other issues that complicate their inability to work. It could be disability, it could be substance abuse, it could be a whole, mental issues. It could be a whole range of things that are super complicated. You can't untangle one need from all the other needs sometimes.
Absolutely. So many of the cases we see are rather complicated, where there's complex credit histories, where there may be a history of evictions or issues that come along with having been kicked out of a place in the past. It makes it harder to find somewhere to live the next time around. It may be criminal history that challenges our ability to find work, to find a place to live. There may be substance dependency issues. There may certainly be mental health issues. So while we can't provide all of those services, one of our jobs is to make sure that those individuals are connected to the groups that are doing that well.
And you can make all those connections. And you have a lot of partner agencies that you work with.
Absolutely. Through the Greater Virginia Peninsula Housing Consortium, we gather at least every other week together to talk about homelessness issues. From the clinic perspective, we're talking with the hospital on a regular basis, with a number of different organizations and dozens of churches here in the city of Hampton that help us and complete our mission as well.
Is that new that you guys meet to do this sort of wraparound services? I mean, it makes a tremendous amount of sense now, but I'm not sure that 5-10 years ago it was quite that well coordinated. How did you guys learn to do this?
Well, it's, I think, a peninsula-wide effort, and it certainly some of the direction came down from the housing and urban development as well, requiring continuums of care when it comes to housing to take on these group efforts to provide some of these wraparound services. And I think we've seen clear results with being able to have people stably rehoused and have them transitioning from homeless situations.
Right, because if they get to one stage and then the support is gone, the likelihood of them succeeding isn't quite as good.
Right.
But if that service level continues, it makes so much more sense.
And seamless handoffs to the next organization is incredibly important.
Okay. What about day services? What about people who need a place for mail or to do resumes or to shower or any of those kinds of things?
We've got all those options, actually. We have a day center down in the Buckrow area. It's right on the corner of Buckrow Avenue and 4th Street. People are welcome to come in. Our showers and laundry are available Monday, Wednesday, and Friday mornings. They can come in, take a shower. We provide the towels. We provide the hygiene products. Sometimes we even have some extra clothes around if people need to change. We also offer a mailing address, a physical mailing address, because mailman doesn't always drop off to the woods.
That's right.
And we also have some computers there that can help you do job searches, to write resumes, and we also have our case manager down there, so there can be direct interactions with her to see if there are ways that we can get people connected to services.
That is awesome. That is really impressive. So all of these resources are going on within our community. If someone needs your services, they need to call, come by, go to the website. There are ways to help them. I think sometimes people give up or don't know or are proud or afraid that they'll lose some independence or, there's just a whole host of reasons I think that people are afraid or reluctant, but it can make a difference.
Absolutely.
It does make a difference.
We are making a huge difference thanks to the support of this community, the support of our faith community, and with our collaborations with so many other organizations here in this area. We are able to make a huge difference in the lives of so many people here in the city of Hampton.
This might be a question that you can't answer immediately, but ballpark, how many people do you touch a year in all of these services between the Night's Welcome, the clinic, the day clinic, transitional housing, all the things that you do?
We're over 1,000 different unique individuals that we're dealing with on a yearly basis.
That's a lot. That's a lot of need in our community, first off, but it's also a lot of help in our community and people getting the resources that they need to become stable. Thank you.
Our pleasure.
Thank you, and your volunteers and your board.
Yes, I certainly can't do it without the support of so many people.
So speaking of support, Matthew, what do you need at HELP to continue to do this work?
Absolutely. Well, we're always dependent on volunteer hours. We use, between all of our programs, we're about 30,000 to 40,000 volunteer hours every year support the work that we do. I'm a huge proponent of people bringing their skills and talents to us and saying, how can we put these to work? I don't like putting people in a box and saying, hey, this is the job that I want you to do, regardless of what you've ever done. But if you have significant skills in a certain place, if you're an electrician, if you're a plumber, if you do auto maintenance, if you're an accountant, whatever you do, there's somebody in this community that needs your skills, and I'm sure that we'll interact with them at some point, and I'd love to be able to call that person and say, hey, could you give me a hand with this? and we're always limited simply by finances too. So the more support that we receive from our community, from our donors, the more that we can accomplish here in the city of Hampton as well.
Great. So you do need money. You get some money from the city, I know. You get some grants. You
Absolutely.
work with a lot of other agencies who get grants. But obviously, community donations make a big difference.
A huge difference, yeah.
All right. Is there anything else you want to add before we close?
Not particularly. Just a huge thanks to everyone who's supported us in the past and continues to support us going forward.
Because this organization has been around for how long?
We were started in 1982. So
I was
we've
going to
been
say, as long as
over 30
I
years.
remember, as
Yeah.
long as I've been here.
So there's
that's
thousands of volunteers, thousands of folks that we've been able to help. And just I think there's a great track record of being able to assist this community in just being better at helping those in need.
Absolutely. Thank you so much.
My pleasure.
And thank you for watching. I think as long as this organization has been around, many of you have helped financially or by volunteering and will continue to do so because this is a track record. You can tell how much they've expanded from those early years, how many people they're helping to become more stable, more productive, and more contributing members of our society. Thank you for watching.